When a child has a stomach virus, it's really hard to eat. You don't have much of an appetite. So don't worry about the food. Focus on the drinking and making sure they stay hydrated. But you really need to make sure at least that they're drinking if they don't want to eat. So ways to help them drink is anything cool is great. I would stay away from juices because the sugar can make it worse. But you can get something called like Pedialyte, which are electrolyte drinks. And I always tell my patients to make them into ice pops because when they're ice pops, they're a little bit more flavorful and they're a little bit more tolerable to take. And just make sure that they're taking small amounts. So you do a couple sips, and if they tolerate it, then you can increase the amount. So every couple minutes, you slowly increase the amount that they take. And that's really important because if you give too much fluid too quickly, it can cause them to throw up and also make their diarrhea again worse. When your child has a stomach virus, a lot of parents are really concerned about the eating part and how to get them to eat again. And I tell them to take it slowly because it does take a while. It could take up to a week before they really feel back to themselves. Take the eating slowly and give them small amounts. Focus on the drinking, but when they are ready to eat, give them what they like. But I would stay away from sugary foods, fatty foods, anything greasy, and focus more on healthy fruits, vegetables. So a lot of parents ask me about the bananas, rice, apple, tea toast, known as the BRAT diet, to help their children cope with the stomach bug. And the newer evidence is showing is that it's not always the best option because it doesn't have all the nutrients that the child may need. So I would definitely incorporate bananas and rice, and you could do the apple and toast, but you also want to make sure to try to also get other foods if they're able to tolerate it, like lentils, maybe some soups, because it's important to give them some protein and some nutritious foods that the BRAT diet doesn't always have. When it comes to diarrhea, we do not recommend any antidiarrheal medications because it is so important for the virus to run its course and get out. But what we can do, a lot of the studies have shown that probiotics can be helpful. If it's an infectious diarrhea, that it can help shorten the course because the probiotics help replenish the gut with the bacteria that it's losing in the diarrhea. So that is something else that you should talk to your doctor about.